As a medical professional, an eye doctor, what do you say to people who are reluctant to take these maybe miracle vaccines, we can call them, that have been developed in record time?
Well, I'm going to give President Trump and Vice President Pence, the administration, and all of the healthcare workers, this was both private and public, and the pharmaceutical companies, pre-funding them to develop this vaccine. I am ready to get the vaccine as soon as it's available. There will be a ranking and a prioritization, as there should be. Healthcare workers, those on the front line, first responders, those in long-term care facilities should have the vaccine first, those that are most vulnerable, that are at high risk. We also, and then essential workers, and then we need to look also at people of color and how does that fit into, if in fact what we saw early on in the vaccine, that there was a higher risk in those populations, even when they're healthy. I think that has to be figured into the recommendations. And the CDC does have a priority algorithm for who gets vaccinated first. And I think that process should be followed. But absolutely, I will get the vaccine as soon as it's available for me to get it.
And what do you say to people who have reservations about vaccines generally, as well as specifically about this one? That was an issue in America even before this pandemic. What do you say to them?
There was a backlash against vaccinations, and as the former director of the Iowa Department of Public Health, vaccinations save lives. Even 2 years ago in 2018, there was a measles outbreak in, I think it was Malta, and the vaccination rate there was only 57%. And, I think it was over 1,200 people ended up dying from a measles outbreak. And with global travel, we see those types of, childhood diseases that, we had gotten to a point in the United States where there was no measles outbreak. So strong proponent of vaccinations. I don't think it should be mandatory, but I would encourage every single person to get the vaccination. It's safe. It's effective. I mean, more effective than the vaccine we have for influenza at 90% or greater efficacy, and I would strongly encourage people to do it.